By the summertime, we had gotten up to around 80 cases a day on average. This floating average, 7-day average. We were able to bring the cases down to in the low teens and sometimes single digits. But recently, particularly over the last couple of weeks, we've seen our new cases rise to the point that we're well over 100 per day. I believe our highest was a couple of days ago, around 190 something. Yesterday was 150 something. So every day there are new infections. So as we look at what the trend is and how we are going to address this trend, we put together a strategy that we're going to be announcing today. And we'll start off with talking about public facilities. Our goal was to have City Hall open to customers, everybody back to work on a 5-day schedule, the public coming in, getting service. But because of the new spike, we will not be doing that. We made tremendous capital improvements to create a safe working environment for our employees. But again, because of the spike, we are now going to revisit what we're doing and have some in-person and virtual working being done. All this, again, to protect our employees, but at the same time, we're going to allow each department to evaluate their staffing and how they want to staff, whether virtual or in person, and what portion is either or, and because we have to be able to have performance and have some outcome in service delivery. So I'm going to turn it over to Darnell Brown, who's my Chief Operating Officer, and he'll give you an indication of the investments that we've made so far to protect our employees and to create a safe work environment, some intended protocols for bringing the public back in, but now how we reevaluated that, and we're going to more of a hybrid system of virtual and in-person working. So I'll have Darnell come and he'll talk to you about that, and then we'll go to the next segment. This is the first segment. I think we got about 3 or 4 segments, and I'll introduce each one and bring the appropriate person up to talk to you about. All right, Darnell.
Thank you, Mayor, and good morning. I want to start by talking about the protocols that we went through for not just City Hall, but all public facilities, as the mayor indicated. We completed our assessment for occupancy of City Hall and all facilities. The mandate was that we had to reduce our occupancy by 50%. We went through a very detailed assessment of all buildings and facilities to arrive at what that occupancy loading should be. We then set in process, working with our consultants to procure the types of barriers and other capital investments that we needed to secure and protect and provide a safe working environment. So protective barriers were put in place, social distancing, signage, etc., and protocols were put in place as well. Hand sanitizing stations were put in place, and as I said, signage. Based on having that done, getting that done, we were ready to reoccupy a number of facilities. That did move forward. In addition to the physical improvements that we made at all of our buildings, we also implemented personnel protocols for the safe entry into each of our buildings. And that required each employee to do a self-assessment daily, noting whether or not they have anything that looks like symptoms for temperature, fever, or cough. That message is reinforced every day by an email and also in City Hall here, actually through our PA system. In addition to that, we do temperature screening at our entrances, so every employee entering the building gets a temperature screen. so that we make sure that no one is above 100.4. Anybody who would not be admitted to the facility. That was the plan that we had in place from the beginning. It has worked well to this point, but as the mayor said, we are not at a point in time that we are looking at what to do as a result of the spike in COVID-19 cases. Also understanding, as the mayor did indicate, that we did also have a plan in place to return the public to our building. That was ready to be operationalized, but that is on hold pending a reduction again in the impact of COVID-19 in our community. Where we are right now, as a result of the spike, as the mayor said, we're asking each department director in an effort to ensure the safety of employees, that we look at the ability to reduce staffing in our building, while at the same time maintaining what I'll call continuity of service. That means, well, what are the things that we have to do as part of the bread and butter service deliveries for the citizens of the city of Cleveland? What is the level of effort and staffing that it takes to do that? And then arriving at the number of employees that it will take to safely provide that level of service, and recommending how many folks physically have to be in the building versus how many people can now do what we call telework. So to the extent that we can again be in a place where we're recommending the number of people who can work from home safely and be productive, and allow again for us to have continuity of service. That is the goal as we move forward in the process. The other thing that we're doing in concert with that is there is obviously continual maintenance of the facility in terms of doors, knobs, drinking fountains, etc. We'd also do what we call deep cleaning. That will be done twice a week. We basically purchase fogging backpacks that have our hydrostatic units that allow us to really clean large areas. And so we will do the entire buildings twice a week. The product that we have procured lasts for about 72 hours. So we believe that in doing so, in addition with our regular cleaning, that will be in a place to maintain a safe and healthy work environment for the employees. We certainly are looking forward to the engagement with our department directors to further refine the ability to reduce the work schedules so that we have approximately half of the employees in the building that we currently have on any particular given day. But again, that's balance between the reduction in number of staffing and the continuity of our ability to provide the level of service required. Thank you.
And Darnell was speaking primarily of back office work, administrative people, but as you know, we do have critical and essential people who are working every day, 8 hours a day, whether they're in public safety, waste collection, streets, those kinds of basic operation that have to have an everyday touch with the public. So, but inside the buildings and where we have offices and administrative, we are reducing the density, even though we put up the protective infrastructure to protect them, to bring them back 5 days a week. With this new spike, we're going to go back to the hybrid model and really measure it on a weekly basis to make sure that we're able to deliver the service that is required of them. Now, the next area I want to go into is enforcement. As you know, when there was a gradual reopening, the key to us being able to successfully gradually reopen under the state mandate was to enforce and to ensure that people understood that the pandemic was not over, and that there was still some basic rules that people needed to follow, the general public. And that was stay at home unless you have to go out. If you do, wear a mask, keep social distance, and constantly wash or sanitize your hands. At the same time, there were business establishments that were giving protocols and that we put protocols in place for them to safely open up their businesses, whether they were these big box stores or whether they're bars, restaurants, nightclubs, barbershop, beautician shops, those kinds of things, and suggestions that we made to the office buildings where people downtown and other places where people had their administrative side of their corporations. And so we were doing that. But again, the key to it was to ensure that people had to follow the rules. They couldn't just assume the pandemic was over with and just go back to normal way of doing things. There were rules that they had to follow. And we passed legislation, and we had mayor's emergencies that was very clear on that. And we sent out enforcement teams between public safety and Department of Health to ensure that those who we were able to inspect ensured that they were in compliance with the rules. And people got used to it. The businesses got used to it. They made significant investments. We helped in some regards to some businesses reopening and helping them with their investments. But now what we have this new spike that is a severe spike, and so we're not only going to continue what we've been doing, but we're going to enhance our enforcement efforts, not just in terms of businesses, but also looking at where the contact tracing is telling us that the new infections are coming from, and that is when people are relaxing themselves in terms of their social gatherings, whether it's in their homes, out in public spaces, or whatever, but people are relaxing, and as a result of that, there's been this spike in new infections. So I'll start off with Safety Director, who will talk about his role, and then we'll go to the Health Director, who will talk about his role.
Morning, Cleveland. Thank you, Mayor. The Mayor is correct. This spike in COVID-19 has resulted in our increased enforcement in combating and ensuring that there is a following and compliance with COVID protocols. Early on, when the pandemic came out and we did businesses reopening, we approached these businesses, enforcing and educating about the mayor's proclamation and about the legislation that was passed. We informed them about the requirements for wearing masks, the requirements to facilitate social distancing, and the posting of signs. We went out for several weeks conversing and speaking with owners and managers of restaurants and bars, letting them know what we expected, what needed to be done to be in compliance. And then we went out and we began to issue citations. We were going out on Thursday, Fridays, and Saturdays, peak times for many of these establishments starting at around 10 p.m. We have now adjusted. We're going out, we have a constant district by district effort to ensure compliance. We're doing a coordinated effort on Thursday, Friday, Saturdays, and Sundays. We're going out much earlier to meet the businesses where they are while they're serving patrons, to make sure that they are serving patrons in a safe environment, that the signage is posted, that folks are wearing masks, that social distancing is facilitated, that people are acting in compliance with the mayor's emergency proclamation and with the Cleveland Codified Ordinance that was passed earlier this year. We are also visiting establishments that we receive complaints on as after hours. Operating after hours. We are making sure that if they're operating and they're in violation, that they receive citations and warnings and education as well. We are going out, this is a collaboration between the Cleveland Police Department, the Department of Health, and oftentimes our state liquor control partners join us to ensure that there is compliance with the state's dine-in order. This virus is something that we have to take seriously. Earlier in the year, we said that there was no acceptable amount of loss. That maintains to be true. This spike is very concerning, and we will continue to increase our efforts in enforcement throughout the week, and an elevated effort on the weekend, district by district, making sure that people are complying with this with the Cleveland Codified Ordinance and the mayor's emergency proclamation. Again, that is making sure that there is masks are required. It's very important. Masks are it's a common sense approach to combating this. It's something that everyone can do. We are ensuring that there are social distancing, that there's a COVID maximum occupancy floor plan in every business. That means that the maximum occupancy of that business is reduced to facilitate social distancing safely. We have seen numerous establishments set up barriers, whether it's plexiglass or wood, and adjusting their seating accordingly. And we're very appreciative of that. We've also seen some establishments that are a little slower or not in compliance, and we are making sure that they're in compliance as well. With that, I'll turn over to back to the mayor.
Before I turn it over to the health director, let me we'll have him blend in the enforcement side with what we're going to be doing moving forward in terms of new activities that we'll be engaged in. But as a lot of what is going on, according to the contact tracing, is not associated with businesses necessarily. A lot of what's going on in terms of new infections is associated, again, with people letting their guards down in smaller gatherings in homes or out in parks or block parties or other kinds of things, even weddings, the receptions of the week after funerals, and those types of things have really been the source of the new infection and spread, as I understand it. So the health director will not only talk about enforcement, but he'll also talk about our future, our plans going forward in terms of increased testing, tracing, and other efforts that we're doing to help not only identify where it's coming from, but to put resources in those areas to help address it. Director.
Thank you, Mayor. As the mayor and the director, Director Howard summarized, some of the enforcement actions we are taking. In collaboration with our public safety department, we will continue to go out and enforce the codes and regulations to address to adhere to these policies and procedures to reduce the exposure. Cleveland Department of Public Health will begin to focus on restaurants and bars, establishments where we have authority to enforce during the day. So our inspectors will be out during the day and continue to do their routine inspections, but also increase the enforcement of the COVID rules and regulations. As we, in addition to that, we will begin or continue to do our night sweeps with public safety so that we can ensure that we're enforcing there as well. We are going to use our contact tracing and the data that we receive, complaints that we receive, to dictate where we go and where we can enforce. For the areas or businesses that we receive multiple complaints, we will first reach out to those businesses via phone, contact them, discuss what's going on. If we receive multiple complaints, we will send inspectors out to verify and confirm that those are violations that are occurring on site and take the necessary appropriate actions against those businesses. So those are three of the areas that we will increase our enforcement action around. With regards to testing in our community, we've identified through in partnership with the County Board of Health and Metro Health to provide testing at our health center on the east side in the Glenville neighborhood. These testings will have started. Will be every Thursday through December 17th. In addition to those testing events, we have scheduled 12 other events throughout the community in targeted areas Glenville, Slavic Village, Lee Harvard are those 3 areas that we will target. This is a partnership with our National Guard. Excuse me. This would be a partnership with our National Guard in which we would provide testing in these high risk or these areas in which we identified as testing deserts. In addition to the increase in testing, we're going to increase our communication and messaging to the community. We will increase our PSAs. We are planning or distributing information at all of these events to encourage people to inform people as to what steps they should be taking to ensure that they're keeping their families and keeping their loved ones safe. That's the key of washing your hands, keep wearing your face mask, and staying 6 feet apart. As we see the increase in in positive cases rise in the city of Cleveland, we want to ensure that everyone adhere to those, and it seems simple rules, but we understand we've been in this pandemic for the last 7, 8 months, and we are fatigued, just like everyone else, but we have to we have to continue to push and continue to adhere to these simple practices and change our behaviors to ensure that we maintain and keep our family and loved ones safe.
Now, as the director outlined to you about the complaints, we not only receive complaints in regards to businesses, we receive complaints in regards to people's homes, and whether they're parties or block parties, whatever they may be. And so the same process applies there. If there's multiple complaints about a particular house or a particular area, then we will send enforcement out there to investigate it. But everyone where there's a complaint, the goal is to have a notice sent to that house, whether it's by phone call or by mail, to let them know that we received a complaint. Now, I'll go to the question side, and a lot of what you have to ask us, we will be addressing during the question and answer period. But I want to really focus and say to you that part of the effort has to be through media also. The message that the pandemic is not over, that there are some basic rules. Stay at home unless you have to go out. If you do, wear your mask, keep social distance, wash your hands. That kind of repetitive message, not just coming from me or from the health department or government, but coming from you and coming from institutions, and to enforce that within your own organizations really goes a long way. So we'll turn it over to questions and answers, and answer your questions. What's the question?
Okay, Mayor, we have several questions. People are asking us to speak a little louder. Some people can hear.
Come on.
Metro Health, the first set of questions, and I'm going to ask some of these, and then I'll come back to this. It's from Mark Namick from Channel 3. Metro Health and Cuyahoga County Board of Health have been regularly providing testing in Cleveland, even though the city isn't in its jurisdiction. Why are they doing it? Why isn't the city's health department doing more testing?
Well, one thing at a time.
Okay.
The question is Metro and the county is doing a lot of testing in the city of Cleveland, and the question was, even though it's not in their jurisdiction, why are they doing it, and why isn't the city doing more? Well, the city of Cleveland does exist in Cuyahoga County, and we are part of Cuyahoga County, and so in the county health board works in collaboration with the city's health department. So we are part of the county, so I don't see why they would not be testing in Cleveland and coordinating what they do with our health department. The director just mentioned our efforts as we'll be moving forward to set up something with Metro Health at John Glenn over in the Glenville area to have testing on a weekly basis for, and then to working with the Ohio National Guard to have 12 testing locations and times over a period of time, 12 testing sites where people can get tested. So we're working and we share information with the county health board and we work with them on this. The Cleveland does exist in the county.
Additional questions from Mark Namick at Channel 3. What are your plans for increased testing and tracing? And what testing is the city doing right now? Does the city have the money and staff to meet
Well, the
demand?
question is, what is our plan to do testing? I think I just talked about that. And in terms of tracing, as you know, the more cases you have, the more it's easier to do tracing when you have a few cases, but when you get a lot of them, it becomes more difficult. We are looking at potentially contracting out a portion of that tracing to companies or organizations who do that on a professional basis to help supplement what we're doing. And what's the second part of that?
Does the city have the money?
Although we have the money and the resources and personnel. We make the money, not in terms of printing, but we make the money available as in a very strategic way in order to support our efforts. That's why collaboration with the county and collaboration with the hospitals and collaboration with National Guard is so important. And so as we look at these collaborations and we look at how we're working together to address some issues, then we'll see where our gaps are, and then we'll spend money in that area. I just mentioned we need to increase our capacity for tracing because of the fight in new cases. So we will invest money there. We have we reorganized the health department, and people have left, and positions have become open. We're working with human resources to bring people on in order to not only fill those spots, but also as we evaluate where we are and what we need. If there's additional personnel with different job descriptions, then we will be hiring those people. So we're in the process now of bringing people on to fill gaps, not just in terms of the pandemic, but the health department addresses many other issues on many different levels, and it's not just the pandemic. So we're addressing the pandemic, and we also have to address those other responsibilities that the health department has. And we are bringing people on, and we're contracting out, and we need immediate help to help us to subsidize and to support what we're doing. And so we will have the money necessary to do what we need to do, and we will hire the personnel to accomplish not only the things around this pandemic, but around those other responsibilities that the health department has.
Again, from Mark Namick, giving the city, can the city really enforce the mask mandate? And given the rising numbers of COVID cases in Cleveland, what options does the city have to limit businesses, meetings, and gatherings?
So the question is, can we really enforce the mask? Well, that's the first part of the question. And I guess we could if we just had the police ticket everybody who walking down the street didn't have a mask. But that's a very impractical thing to do, and something that we would not do. But we have set guidelines and boundaries as to what our expectations are in terms of businesses. And now we are going to do the same thing, even though we've done it to a degree. But now we're going to intensify our enforcement in this social setting environment where it appears that transmissions are occurring and most frequently. So we're going to do that, and part of that is you have to wear a mask. And it gives us the leverage and the tool to enforce something, where we would not be able to enforce it if we didn't have the mandate. Also, we have to look at what is happening at the state, and the state has just issued some, I don't know what to call them, but they're not mandates, but they're suggestions in regards to gatherings around weddings and funerals and things like that. And there are some suggestions that as to how people should behave if they are going to have a reception or wake after a funeral, reception after a wedding, that there are some guidelines that the state has put out. Now, enforcing that would be very difficult because you'd have to know every funeral is going on and every reception that is happening, every wedding that's occurring. It would be probably much simpler for us if we just said that it gets to your second part of the question, if what else could be done. Probably be much simpler if you just said you can't have receptions at the weddings and you can't have wakes at the funeral. Funeral homes are doing a pretty good job, from my understanding, around trying to keep social distances and things like that, and wearing masks at the funeral itself. It is that activity after the funeral that tends to be the problem, if I'm understanding correctly.
The next
Now,
question,
but the other part of your question, what other things can we take against business? I'm assuming that your question is leading towards do we shut down? When you ask what other actions could we take against business, we're going to take the actions that we outlined to you, and we're going to not only continue the enforcement, but to have a more intense enforcement, and to help businesses do what they need to do to stay open and to stay in business. The only other option you have is to shut it down. I will remind you that when things were shut down and then the state began the gradual reopening, I will remind you that our conversation was that gradual reopening will only work if there's an enforcement of the prevention side of staying at home, unless you have to go out wearing a mask, social distancing, washing your hands. If that did not occur, and people assumed that the pandemic was over or they had some liberties that they can take with it, then we would see another spike. And when that second spike came, that it would be far worse than the first one. And that if there has to be a shutdown, the devastation of that shutdown will be worse and go deeper than the first, in terms of loss of businesses, closing of businesses, loss of employment, investments, and all those things. That's where we are. This is a matter of whether or not people are going to wear this mask, whether they're going to keep social distance, and they're going to wash their hands. If there is no other alternative, then ultimately it will lead to a more severe mandates, and it's very difficult to do that city by city by city or county by county by county. This is something that will probably have to happen at the state if you're going to have the full benefit of it, have a statewide benefit to it.
we have several more questions. This question is from Kim Golden from News 5. We received a tip that EMS is currently down about 30 people due to illness. Wondering if you can verify if this is accurate and if there is any impact to shift numbers. And several media outlets asked that.
Well, the question is that they've heard rumors that EMS is down by 30 people because of infection, and what is the impact, I guess, on service, and are we able to man or have the manpower to keep all the ambulances that out on the street that we need to have on the street? I will tell you that you can go, I don't care which division you go to. It could be EMS, police, fire, waste collection, properties, streets. You just name one. And I will tell you there, we're no different than anybody else. We are out in public. We come, people go home, they come to work and things like that. And people do wind up contracting the virus, particularly those people who are critical employees, essential employees who are working 5 days a week, 8 to 10 hours a day. And they're working as if they're in an environment where there is no virus. So that is why safety precautions with them is so essential. But I would say I don't know what the exact number is, but I would say that the answer to is there infections in EMS, I would say yes. If you'd asked me if there was in police, I would say yes. If you'd asked me if it was in fire, I would say yes. If you asked me if it was among waste collectors, I would say yes. Custodians, yes. People who work on the streets, yes, because we're just part of the entire community. But I'll also say to you, if you ask that same question to the private sector in corporate headquarters, they will tell you yes. If you go to our medical institutions and you ask them in regards to the frontline workers at the medical institution, they will tell you yes, that is the nature of this pandemic. It is a virus looking for a host to be alive, and we are the host, and we have not gotten control of it for various reasons. That's another question. From national and state level, that's another question. But the answer to your question is yes. But in the other part of your question, are we able to continue service at the level we need to? The answer to that is yes, sir.
The next two questions are from Sam Allard from Cleveland Scene. First question, what is the current work plan for City Hall staffers? Given the recent surge in cases, will employees who've been working remote for most of the pandemic be permitted to do so again? If not, why not?
Well, the question is, what is about City Hall staffers? Are they, since we have this spike, are they going to be able to continue to work remotely? And answer, I think we answered that in our opening, is that we have prepared to bring everybody back 5 days a week. We did capital investment to ensure the safety of the employees. We even took some employees and built a new office space for them outside of City Hall, where they and connected IT with them so that there wouldn't be the kind of congestion that you would have in a normal work environment, so we could keep social distancing and all that. We made all those investments and did all those things. But with this new spike, it is proved for us to reduce the concentration of people in City Hall and to put people back on remote. Some people had already come back 5 days a week, 8 hours a day. Some had come back 5 days a week, 6 hours a day. Some people are still on 3, 4 days and in person and then working remote. Now what we're doing is telling everyone to go back to the original plan, which is work remotely and then come in partially, and that would help to reduce the number of people in City Hall and giving us the ability to keep a better social distance and prevent infection and spread in regards to that. So we're not having people come back 5 days a week now. We were going to do it a couple of weeks ago, 3 weeks ago. We put it on hold simply because we began to see the trend and spike.
The second question.
Oh, but let me remind you, we are in business to provide service. So we look out for the safety of our employees, but we will be evaluating each department as they recommend how they want to stagger or stage their employees virtually or in person and all that. We will evaluate it and determine whether or not they're able to provide service. If they cannot provide service, they're going to have to present another plan in order to get to the service delivery and to protect and have employees be safe. So it's a combination of the two.
Is there any update on the looming income tax dispute with suburban residents who work in the city? Is the city of Cleveland still confident that the law is on its side?
Well, the question is, what is this legal dispute as to whether or not people are who work in Cleveland, but they live somewhere else and they're working remotely. There's this lawsuit been filed in Franklin County, and I think there's some state legislation that would say that the income tax benefit would go to where they live, not to where they work. And that dispute is still going on. It's a dispute politically within within government and within the state legislature, and it's also a dispute that has been brought to courts. And now right now, the law says that if in fact you have to work remotely, your income taxes paid to your place of employment. That's what it says. And so based on that, we're confident that that's the way it's going to be. If in fact they change the law in the state legislature, that's another thing, or if the court rules something different, then we have to deal with that. I do know that this law that was passed that allows taxes, income tax to be collected at place of employment, not at home, is really part of the state emergency. And Governor DeWine has said that he is not looking at eliminating the state of emergency. So as long as that law exists in Columbus, and as long as there's a state of emergency, then by law we're able to collect income tax from people who may be working remotely, and but their place of employment is really in the city of Cleveland.
The next question is from Connor Morris from Advanced Local. He said the question is, why is the city ending the moratorium on utility shutoffs on December 1st? Will this be for both power and water, and what will people with big back bills be able to do to prevent
All right, so the
shutoffs?
question is, why are we eliminating the moratorium on utility cutoffs and I guess reconnection, allowing for reconnection on December 1st? And what is the city going to do for people? What does it mean for people who have large bills? Well, the state ended their mandate, and which allowed pretty much for utilities to go back to charging as normal. And I believe, how long ago? In July of this year, so it is August, September, October. About 3 months ago, the state lifted that mandate. We took our time in terms of developing a policy and a strategy moving forward because we wanted to ensure that as we began to implement and go back to normality in terms of collecting bills, that we would be able to communicate to people, give them options that they have, give them processes and procedures and programs that they could access to assist them. So on December 1st, we sent out a notice that we will be doing this. And when is it effective? Effective December 1st. Go ahead. Go ahead.
I'll take a shot at this again. So the answer to that question is, it was effective December the 1st. But we have been noticing all of our delinquent account folks for months. We've sent them 3 letters in the last month and a half, and those letters encourage them to call us, contact us, so that they can be engaged in programs that we have available for affordability, homestead, CARES Act funding. County just came out with $2 million for utilities funding. So to work with them so they can take advantage of these resources that have been made available to them. But again, it goes back into effect December 1. But we've also asked them by letter to work with us if they have a problem meeting that obligation.
it does apply to both water and clean public power. But let me point out one thing to you, is that there were people who were harmed by the pandemic in terms of loss of job, and, or in terms of their ability or inability to pay not only rent, but also utilities. And that is why when we received our CARES Act money, we put a significant amount of money into helping people pay utility bills and pay their rent. And then we put money into with businesses to help them in regard. So we put a lot of money in this. I want to remind you that we were doing reconnections also, and reconnections are people who just didn't pay their bills. Some of them bills might have been 6 months old that they hadn't paid. Some people might have not paid for a year or so. I don't know. But many of our expectation is if they weren't paying before, they won't pay now. So we're looking at those people who were harmed by the pandemic, who did not have the ability to pay their bills or even pay their rent. And so we want to relieve their burden in regards to the stress they would be under worrying about this bill. And with them, these are people who normally pay their bill. They just couldn't because they were harmed. They lost their job. They didn't have the revenue. They didn't have the income to do it. So we're going to work with them. We're going to put them on payment plans if they work out a payment plan. If they're unable to pay because they're still unemployed, then as Darnell mentioned, the county just put $2 million into a fund that will allow for the assistance in that regard. There are other programs out there, and we'll work with them. We'll work with them. Our goal, we're service providers. We exist to provide a service to people. We're not a corporate structure, even though we have to follow corporate business models sometime because we have to be able to balance our budget and create revenues for expansion and capital improvements and maintenance and all that. But our primary goal is to service people. And water service is one, electric service is the other. If people are just don't want to pay their bills, that's another thing. If people are harmed where they cannot pay their bill, then we have programs to assist them and we'll help them if they contact us, help them to navigate through this time, hard times that they're going through. What you got?
The next question is from Bob Hicks from Cleveland.com. Can the mayor order the kind of shutdown in Cleveland that the governor has threatened could come statewide? If restaurants and bars aren't following the rules, can the mayor order closure?
The question is, can the mayor order what the governor is threatening to do in terms of closing and shutdown? And the question was specific to bars and restaurants. And the answer, I guess, is yes. I can just add it to the mayor's emergency, proclamation of emergency, and it might get challenged and all that, but yeah, I can do it. The question is how effective it would be. Because if we close down every business in the city of Cleveland, and if you're now talking about bars and restaurants in this question, if we close every one of them down, the question is, how effective would that be in terms of the transmission of the virus? All of the indication is that the majority of them are attempting to comply with the rules and with the laws that we have outlined to them. Many of those establishments have made investments in order to comply. We just changed zoning laws, and City Council passed legislation to allow for outdoor dining in the off season, in the wintertime, and to create an infrastructure for doing that. So we're working with them, and many of them are trying hard, and they're investing to try hard to comply with what they're supposed to be doing and to stay in business. And again, what we're finding during the tracing and things like that is that, yes, there's still some tracing back to bars and restaurants and clubs, but the primary contributor to this spike is not that. It is the social gathering, either in small groups, family, friends, and things like that, or they talk about the receptions at the weddings and wakes at the funerals, all those kinds of things. So yes, we can order those things, but if we just do it for the city of Cleveland, the impact or the effectiveness of that would be very minimal. If you're going to do it, you have to do it statewide. And if you do it statewide, then the impact of that would be similar to what happened when the first shutdown occurred, only this time it would be even more severe than the first time. Because there are people who are still struggling to stay in business now. If you close them down again, they're out of business. They're just out of business. And they appear not to be the main contributor to the increase in infections. And they also appear, from listening to my people when they go out, that the vast majority of them are trying to comply with the rules, the laws, and the regulations to keep themselves, their employees, and their patrons safe.
The next question is from Kirk Allen. Will enforcement be the same for gas stations and other small businesses like bars and restaurants? Gas stations are not enforcing the mask ordinance.
Well, again, we will, if since you just told me that, I'm going to instruct the Director of Health and Director of Safety to look at that aspect of enforcement and to see what they come up with. If there are rules for everybody. And so if they're being left out, this group is not doing it. You've informed me of that. I was not aware. So we'll go. Now, very interesting thing. I don't know if it came from one of y'all reporters, one of the reporters or what, but anyway, it was brought to my attention yesterday. Somebody was talking about after-hour joints. And I'm not just talking about a business where you have a business and then they're operating after the mandated cutoff of 11 o'clock or midnight, whatever that is. They're talking about after-hour joints, illegal kind of stuff, right? And so that was brought to my attention. And since that was brought to my attention, we're going to be checking them out too. So we'll check out gas stations, we'll check out illegal operations, we'll check out legal operations, we'll check out everything and see if they're in compliance. If they're in compliance. And if they're not, then we have the authority to take action against them.
Dwayne Griffin asked, what is Cleveland doing about infection rates climbing in many school districts? Are all schools officially going remote?
The question is, what are we doing about the infection rate in school districts in Cleveland? And is all the schools going remote? Let me, I'm on a call periodically, at least once or twice a week, with other mayors and the governor. And one of the things that has come up and is this thing around school opening and whether or not it should continue to be virtual, in person, or hybrid, a combination of the two. And the governor has pretty much left that up to school districts. Our school district in Cleveland, Cleveland Public School, everything is virtual. They were going to go back, they were going to a hybrid where they would have some in-person and some, and along with the virtual until the spike hit, and then they changed that, and so they're staying virtual. The charter schools, is my understanding, the ones that I know of, that many of those have chosen also to do virtual. I'm not aware what the parochial, anybody aware what the parochial schools are doing? I'm not aware what the parochial schools are doing, but I don't believe that they're if anything, they would probably be a hybrid of virtual and in person. So I don't know of any school in Cleveland, any school system, whether it's charter, public, or parochial, that is 100% in person. I'm becomes their choice. Our school district under Superintendent Gordon, I believe, made the right choice at this time. And hopefully, as we go into the next semester of this school year, that we will be able to have a more in-person combination of virtual and in-person. But right now, it doesn't allow us to do that because of the spike. Oh, by the way, I want to thank all of you for supporting issue 68, and even if you didn't support it, it's over with, and we're going to move forward with issue 68 and the funding necessary to ensure quality education for our children. So I want to thank all of you who did support it, invest in it, and voted for it. Thank you very much.
Christine Kovac asked, where do the recreation centers fall into this pandemic?
The recreation centers, where do recreation centers fall in the pandemic? We have not changed our policy in terms of recommendations on rec centers going forward. What we did was initially we just closed them down, and all the rec centers were closed, and the people, the employees were, as many as we could, we gave new assignments to. Then we developed an approach where the recreation centers would open up in a modified version that allowed for, they couldn't do competitive sports. There was a social distance, mask requirements, sanitations, sanitation environment, all these kinds of things. And we're still in that mode. Now that has significantly reduced the kind of activity that occurs in our rec centers, rather than there being thousands and thousands of kids a day at our 22 rec centers who are coming in and out. Now we'll have maybe hundreds a day, just hundreds, not even thousands sometimes, just hundreds a day. And that's for all of the rec centers combined. So there's been a significant reduction in activities in rec centers because of our modified recreational programming. And we intend to continue along that mode until such time as we can allow for them to be open more and with more contact sports and more in larger groups of kids in one spot. Right now, we're not doing that.
Here we have a couple additional questions from Mark Namick from Channel 3. What budget cuts are you now considering, given that the third wave will directly impact tax revenues for the city? Are you considering layoffs? Why not?
The question is, what's the budget impact of this new spike, and are we considering layoffs? The budget impact is significant in terms of dollars that we have lost. If you heard my state of the city, we are just the hospitality industry alone. We've lost $24 to $26 million in terms of revenues coming from the hospitality industry just alone, and that's not counting other kind of activities that have been either eliminated or substantially reduced, meaning we're losing revenues as part of that. Fortunately, through the COVID-related funding coming out of the federal government and the state, we've been able to offset some of that lost revenue, along with the fact that we budgeted for an economic downturn for this year, and we budgeted, I think, $43 million to hedge against an economic downturn. So between that budgeting factor and some of the COVID relief dollars that we received, we're not anticipating layoffs. Where we got another 7 weeks left in this year, and so we can cover our costs for 7 more weeks in regards to personnel in our operation and delivery service. We, however, are developing our budget for next year. And as we look at the budget that we're developing for next year, we're taking into account those dollars that are just one-time revenues that help us through this year, but will not repeat next year. And so as we develop that budget for next year, it will be a reduced budget in terms of projected revenue coming in. And then we'll, between now and our introduction of that mayor's estimate into council on February the 1st, we will make whatever decisions is necessary in terms of cost reduction during this period of time.
And last question from Mark Namick, but not the final question. If the city is in a crisis, why are we not seeing and hearing from you and council more on this issue? What are we not seeing that you are doing?
Well, the question is since we're in a crisis, why don't you hear from me and council more often? I guess that's the question. They tell me an empty wagon makes a lot of noise, and I don't intend to be an empty wagon making a lot of noise. And so that means that I just do my job and I stay on my game in order to help to protect this city, its citizens, and move us forward. And so every day we are having conversations, not only in regards to just the general operation of the city, but also in regards to this pandemic, its impact on the health of our citizens, impact on our economy, impact on our revenue, things like I met with the finance director yesterday where we had this discussion. So no, you don't see that. But all you see is the fact that we're not laying people off and that we're not reducing service. That's what you see. And that's all you should see. You should see the fact that we are providing services to the people of the city of Cleveland. Now, do we have concerns? Yes, we do. Do we discuss those concerns? Yes. And now, in terms of council, you just have to talk to council as to what you believe they should or should not be doing. They've been very cooperative with us in terms of all the things that we need in order to fight this pandemic and to protect the citizens as well as protect our revenues and help to lower our costs. They've been very cooperative with us. If you have another feeling about that, you need to talk to them directly.
Jason Walker asks, can we begin issuing vitamin D and other health supplements to support the immune systems in the community among EMS and et cetera?
Well, the question is, can we begin to provide vitamin subsidies to frontline workers to protect them while they're out there working? I would not do that because I'm not a doctor and I don't know what impact of that is. And I imagine, as you probably know, that depending on the individual, to give a vitamin D to this person, it might help over here. It may cause a problem. And then there's levels of vitamin D or E or C or whatever that because anything too much of becomes harmful rather than beneficial. So that's not within our privilege to do that. However, the point that you're making is a valid point, and that is that people should be looking at their individual health and trying to maintain it as much as they can, because with this particular virus, it not only does it need a host to survive, and we're the host, it then goes to the weakest part of the host and attacks it. And if we're not able to fight that off, since we don't have a vaccine, and since we don't have the same medical care that a higher ranking person would have, like President Trump or Vice President Pence or other people who have a lot of money can get a better care, then you're going to have to kind of maintain your own health in that regard. So if people believe that they can help improve their health by doing certain things, whether it's exercising, eating right, drinking more water, talking to your doctor about what supplements to take to help with underlying ailment that you may have, that is very important. So I get the gist of what you're saying, and I believe that you're correct. We just cannot do it as government.
And the last is a comment from Lisa, who says, as a nurse, I am grateful for the action taken towards businesses that do not understand the severity of what a pandemic means to this great city. I am glad to see the additional testing in the community. The transparency shared is much appreciated.
It was a comment around, from a nurse that that she is happy that we're taking action against those who just won't comply with the rules, and that our increased efforts on testing and those other kind of things. And I imagine even our increased messaging to people, she appreciates, and I appreciate the comment. Do we have anything else? We don't have any more questions. I appreciate you all tuning in, and I apologize again for being tardy. I apologize for the competent attitude in terms of our technical difficulty, but that's just what happens sometimes. So I'll talk to you later. Bye.